Welcome to today's Explainer, where we're jumping right into exactly how artificial intelligence is fundamentally rewiring the entire healthcare industry. We're going to track this massive transformation across the whole spectrum of care, scaling from those huge nationwide population screenings right down to the literal microscopic cellular level. If you follow digital health, you already know AI isn't just some far-off futuristic concept anymore, but the sheer scale of what's happening on the ground right now, it's honestly staggering. So, let's kick things off with this quote from the Fitchy KPMG report. It really sets the perfect tone for what we're looking at today. Dr. Sanjeev Singh hits the nail on the head here. AI can process mountains of medical data in absolute seconds, helping doctors diagnose earlier and really personalize treatments. Basically, it takes these massive systemic bottlenecks, things like workforce shortages and crazy disease burdens, and flips them into real opportunities for proactive care. Here's our roadmap for unpacking all of this today. We'll start with the overarching revolution, then look at bridging the access gap, move inside the hospital to check out operations, and wrap up with precision diagnostics. Okay, Section 1, the AI healthcare revolution, shifting from reactive to proactive care. So the big takeaway from that FICCI KPMG report is this massive paradigm shift. For the longest time, healthcare has been entirely reactive, right? Just waiting until a patient is already sick to actually do something. But by weaving AI into the entire value chain, we're flipping the script to a proactive, data-driven strategy. We can predict risks before they happen, personalize the interventions, and build this continuous, scalable journey of care. Moving to Section 2, bridging the access gap, reaching that critical last mile of healthcare. The million-dollar question is, how do we get this advanced care to everyone, no matter where they live? Well, in India, Reliance is tackling this head-on with a massive 10 lakh crore rupee investment. They've rolled out the Geo Arogya AI clinic system. This thing is wild. Patients literally step up to an AI diagnostic kiosk. It acts almost like a sci-fi smart mirror that scans their eyes and skin for an initial check. Then they talk to a voice-based AI doctor that speaks multiple Indian languages. The system instantly categorizes their risk and flags urgent cases for human specialists. So AI does the heavy lifting of triage, but a human doctor is always in the loop. And it is not just the private sector doing this. The Indian government is completely restructuring public health delivery at a mind-blowing scale. Ekadok has triaged over 10 lakh patients. Sonoday AI is using voice tech to crank out hundreds of thousands of e-prescriptions. And get this, the national telemedicine platform, e-Sanjivani, integrated AI and has supported over 282 million consultations. Even local tools like Cough Against TB are boosting detection rates by up to 16%. This is exactly how you bypass a massive specialist shortage for hundreds of millions of people. Now that naturally makes you wonder about other parts of the world. Take rural areas in the US, for example, which have their own brutal geographic barriers, spotty networks, and super long drives to the nearest doctor. How do we bring this level of tech to their last mile? Well, they're building out this incredible hub-and-spoke model. Tata Ellisy teamed up with University of Illinois Urbana-Champaign and OSF Healthcare to drop hyper-localized digital health kiosks right into rural Illinois. Funded by Jump Arches and powered by Tata Ellisy's T-Engage platform on AWS, these kiosks bring the Internet of Medical Things, so smart vital sign monitors, and telehealth directly to the community. It's step-by-step infrastructure that turns a simple local kiosk into a lifeline, bringing proactive care to folks who honestly had none before. All right, Section 3, transforming hospital operations. Let's talk about cutting through those brutal administrative bottlenecks. Stepping inside the hospital walls, the operational drag is a huge issue. To fix this, big IT players are jumping in. Wipro, for example, just spun up a dedicated AI native business unit. Their whole goal is to scale up enterprise-grade agentic AI. Basically, AI that can independently spot a back-end problem and just fix it. By natively building this into systems like their IHS and HPS platforms, they're stripping away the complex back-end mess and unlocking value way faster for healthcare providers. To really visualize this operational shift, think about a standard manual nurse handoff. In the past, handing over shift notes took about 90 minutes. That's the length of a whole movie, just dealing with fragmented data and missed communications. Well, Manipal Hospitals worked with Google Cloud to completely overhaul this. They brought in a generative AI solution on a unified data cloud, giving nurses instant, real-time patient data. And just like that, handoffs dropped to 20 minutes. That is a massive 78% reduction in time spent on handoffs. When you scale that across a busy hospital, you are literally unlocking millions of minutes of caregiver productivity every single month. It slashes human error, keeps care consistent, and most importantly, it gets nurses back to actually caring for patients instead of doing paperwork. And Manipal Hospitals pulled off a similar win with their e-pharmacy. By using Google Cloud's Gemini on Vertex AI, they automated the data transfer between the pharmacy and diagnostic departments. Medication processing went from 15 minutes down to under 5, and they're handling crazy volume spikes for over 100,000 patients with near-perfect accuracy. That is the definition of AI slicing right through an administrative bottleneck.
Finally, Section 4, Precision Diagnostics and Treatment, Visualizing the Invisible. Let's zoom all the way in to the clinical level. Check out this phenomenal collaboration between L&T Technology Services and NVIDIA. They've built an AI-powered 3D lung digital twin. Using NVIDIA's physical AI infrastructure, which means the AI actually understands real-world physics, it takes standard CT scans and builds a fully interactive 3D digital twin of a patient's exact lungs. We're talking airways, blood vessels, lesions, the whole shebang. Doctors can actually run procedural simulations for biopsies and bronchoscopies before they even make a single physical cut. This kind of immersive environment is a total game changer. It gives clinicians a highly advanced second pair of eyes. This is a huge leap forward for precision medicine, giving surgeons a level of confidence and accuracy that was practically impossible just a few years ago. And the micro-level innovations are just exploding right now. Tech Mahindra built an AI tool that predicts antimicrobial resistance for infections like UTIs without even doing physical clinical tests. They are also computationally predicting if new drug molecules will succeed. Over at Tata LLC, they've set up a biomedical sandbox with SCTIMDST to co-develop next-gen cardiovascular and neuro devices. Plus, their T-Care platform is pushing digital therapeutics, using AI and AR for evidence-based digital interventions. It's truly wild stuff. So, that brings us to our final thought for this explainer. We've looked at how AI is completely reshaping the landscape, from those rural health kiosks and ultra-fast hospital e-pharmacies, all the way to 3D lung twins and predicting drug resistance. With AI shifting this entire massive industry from just reacting to sickness to actually predicting and preventing it, how is this predictive power going to change your very next healthcare experience? Thanks so much for joining me today, and keep exploring the data.